aid agencies are warning about the risk of waterborne diseases in Myanmar following the devastating earthquake in March. Save the Children say access to clean water has been severely disrupted. Jeremy Stoner is the Save the Children's Acting Asia Director and he joins me now. Jeremy, thank you so much for your time. Just briefly, can you give us a bit of an overview of what the conditions are like on the ground there at the moment?
Thanks very much. So we're into day 11 of this catastrophic earthquake. And we've passed that phase, really. I think we won't be finding any more people alive under the rubble after 11 days. But actually, as with all major earthquakes, the coming days are absolutely critical, and weeks absolutely critical. So we've had some unseasonal early rains in Myanmar. The southwest monsoon normally starts in about a month and a half or so, but we've had some early rains, compounded by the fact that a lot of people since the earthquake struck are still living outside. There's people living out on football pitches, in monasteries, etc., under the stars, literally. And the rains, some early rains have set in. And I think what's critical about this phase of our emergency response, and indeed that of others, will be to prevent waterborne diseases. Now, in any huge emergency like this, we're talking about 17 million people affected across 57 townships in Myanmar. But in any major emergency like this, children, and particularly children from the ages of 0 to 5 years old, are super vulnerable to things like waterborne diseases. And we've seen in Myanmar in the past, cholera is endemic, and other diarrheal diseases as well. And these kill children. And so we have been, since day one, distributing water and food, obviously, basic necessities. The day before yesterday, we managed to put up just under 500 shelters. These are just tarpaulins, ropes, basic things to keep people out of the sun and to keep the rain off, the unseasonal rains off as well. So, but the fact is that throughout Myanmar, in the worst affected areas, water pipes, water systems have been broken, and access to clean water is fundamental, it saves children's lives effectively. And that's where our focus is on right now. So clean water for communities. And along with that, we've been distributing hygiene kits. So this gives people a chance for the first time in maybe 11 days, in some cases, to wash properly with soap, with buckets to carry water, with towels. A bit of dignity after what's been probably the most immense shock in Myanmar, probably for the last 100 years.
Can you take us through what sort of medical facilities are available on the ground there? Obviously, this earthquake was devastating and has led to damage and destruction to medical facilities and hospitals. So what is available to treat illnesses in children and people there?
Right. Well, as you said, I mean, I think in one township, when I was speaking to a community worker, he was saying that 200 buildings collapsed immediately. And among those were health centers, a hospital, as well as schools, etc. So the infrastructure in the worst affected areas is badly hit, either totally destroyed and or in a state of disrepair, which means it's dangerous to use those facilities. So the health services that are working are basically overrun with people desperate to get access. But people are getting access to some level of health. But in some areas, the more remote and difficult to access areas, it's very, very difficult for people to access any healthcare. We have in Myanmar, Save the Children has got 3 mobile clinics that we deployed immediately after the day after the earthquake. And these mobile clinics are going to some of the most difficult to reach areas in 4 of the 6 regions where we're working that were most badly affected. And these are basically providing emergency first aid to people with fractures, with cuts, who've had literally their bodies badly damaged in the earthquake, but also providing regular healthcare to patients that haven't been able to access health. So health is one of the absolute priorities that we have. As I say, we've got 3 mobile teams, but the infrastructure is so damaged that that what is available is it's got huge queues and people desperate to access those services. So a pretty dire situation.
Absolutely, and there's been a military ceasefire in place in the immediate aftermath of this earthquake. Are there concerns though about that increasing as these recovery efforts continue now that we are sort of a week after the event?
Yeah, so I think for me, obviously, ceasefire is something that has happened, important, very important. But I think for me, possibly the most concerning aspect of this particular earthquake is the damage that there's been to the infrastructure that we described earlier around health facilities and schools, but also roads and communication. So this means that there are still some communities that are difficult to access. And we work directly ourselves as Save the Children, but we also have a network of partners that we've built up nationwide since we started working in Myanmar in 1995. And so what we're hearing on the ground is that some of the access to those areas is particularly difficult because of infrastructural and other damage. And of course, those are the areas that we are trying to prioritize the most, because some of the children that live in those areas and have been affected are those that are most vulnerable in this earthquake.